Hello, I'm Marina Martin. I'm the home care champion at CareLineLive. So recently we did a single assessment framework webinar, just looking at the new CQC framework, and there was quite a few questions that we couldn't answer on the day because we had such a lot of people there, and this is going to be my opportunity to answer those questions. It's difficult to say at the moment. So what's happening is that CQC are registering people on a first come, first served basis. What I would say to you is that it's really important that you make sure that you have all the information that they need and that it's accessible to them, so the process can be swift. It is taking in excess of 10 weeks at the moment, so just make sure that you've got everything in order before you start that process. In terms of registrations, you can register on the new provider portal for a new service and also for a registered manager. The only people that can make any alterations to registrations or do those new registrations will be a registered manager or the nominated individual. They're the only people that will have access to the portal at the moment. But do follow those portal guidelines as you go through the process. I think it's really hard to say what you can expect. I think CQC are being very lenient at the moment. They're not looking at everything really in depth at the moment. They're choosing specific quality statements to look at. I would say make sure all your details are correct, all of your contact details, any changes at all, make sure that they're updated. Make sure that your provider information return is absolutely up to date with all of the current information that you need. Have a good understanding of the key questions. You know them already. They're the same as the key lines of inquiry. So the safe, caring, effective, responsive and well led. You know those. Just make sure that you understand all of the quality statements. They're quite straightforward. If you go onto the CQC website, you can see them all there. Also, you can go onto CareLineLive's blog, and we have all of the information about the single assessment framework and all of the key questions. Now, this includes the key questions, the quality statements relating to each one, and also the evidence categories. I've even given you information about the sorts of information that you can have prepared for CQC. So that's the easiest way to go about it first. Just make sure that you've got all of your information that you actually need. And CQC will not approach you for evidence unless they need it. So what they're saying at the moment is, do not proactively provide evidence. They will ask you for exactly what they need. I think it's really important to make sure that your care plans are, as we all know, person-centred. And that means getting as much information and detail about that person as you always do and always would. So, for example, in the About Me assessment, you need to collect lots of information about what's important to that person. What are their likes? What are their dislikes? About their history, about their family, about their friends, about what their needs are now, what their aspirations are in the future. You really need to sort of add that in to your we and I statements. I would also say that when you do your tasks, I would be writing those tasks in the first person. It makes it much more personalised, and it gives the carers a much stronger feeling that they're actually dealing with a person rather than just a lot of words. I personally would say you always need to use the I statements, because if a person hasn't got the mental capacity to give you as much information as possible, you should be liaising and speaking to family members, advocates, whoever it might be a case manager, whoever it might be. You need to be liaising with them and getting as much of that person-centred information as possible. I think care planning can work very, very well with the fundamental standards, and there's a couple of things that I want to say about the fundamental standards. I think when you onboard a client, it's really important that they have a copy of the fundamental standards. I've always done that. I've given people the information about making a complaint, their terms and conditions, consent forms, but also the fundamental standards, so that people using your service know exactly what to expect from their care plan and from your service. So in terms of ensuring that those things are part of your care planning, you should also make sure that your carers and your staff really do understand what the fundamental standards are saying, what the expectation is for care. So I think you can really use those I statements, those we statements in your care planning. And when you're speaking to your clients, you can also use the we statements, and you can give that as evidence to CQC. This is how we approach clients, and this is what we tell them what we can do and what they can expect. So within the webinar, we sort of touched on writing care plans in the first person. In my opinion, I think care plans should be written in the first person. It is controversial. Not everybody agrees with that, but a lot of people do. So it's a little bit, you're either one way or the other. For me, the care plan is owned by the person. It's not owned by the care company. It's not owned by the carer. It's owned by that person. It's about them. It's person-centered. So in my mind, whether they've got mental capacity or not, that doesn't matter, because they will have an advocate that is charged with speaking for them. So it's very, very important from my perspective to make sure those care plans are person-centred and that the tasks are person-centred, the feedback's person-centred. No, it's very much dependent on what the incident is. So if you go onto the CQC side, there's a list of events and incidents that you would report to CQC as a statutory notification. So you just need to use that for reference. Often you will find that you might have an incident, but it could be a near miss, or it could be just the fact that a carer needs a little bit extra training or something like that. So that they aren't really things that you CQC need to know about. If you were giving all of that information all of the time, CQC would be inundated with incidents that are not really specific to what they need to know about. Okay, so your provider information return is something that should be kept up to date at all times. CQC want to see them once a year. So make sure it's up to date and that you're not going to be completing that last minute. Now, in terms of timeframes, if we could just remember that there aren't timeframes for inspections now, and inspections will be absolutely targeted when there's a clear need to do so, or CQC feel that they need to do a face-to-face meeting because of the type of service. So what I would suggest is that you just keep everything up to date, and just remember that there isn't going to be an inspection. There's going to be continual assessment right across the board.